Okay, hello everybody. How are you doing? All right, yeah, let's get a big wave. It's exciting for me to do something in person instead of lecturing to a computer screen. This is awesome. So yeah, a wave so I know that you're not a virtual background, please. Thank you. All right, this is great. We're going to talk about increasing your fulfillment and reducing the frustration in your practice. Here's the disclosures, not much there. What I really want to start with is to start with, where are you at? Just think to yourself. You don't say this out loud, but if 0 is totally burned out, and 10 is life could not be any better, pick out a number, okay? Just for a second, just for yourself, pick out a number, because whatever number you're at, the point of this lecture is to move you to a higher number. So if you're number 2, can we get you to a 5? If you're 6, can we get you to an 8? If you're 7, can we get you to a 9? So, it's not just about burnout. Wherever you're at, can we have you be more fulfilled and less frustrated? But, well, here's who I am. I'm Jay Winter. I've been a family doctor for over 30 years. And about 30 years ago, I started the stress reduction program at Sansom Clinics that so many of my patients were stressed out. I lectured a whole variety of groups on stress, but do a lot of lecturing lately on physician and healthcare practitioner well-being. And I'm the author of a book called Relaxation on the Run. So that's me. Now, if you're burned out, again, the lecture is not just for burned out people, it's whatever your level of satisfaction, but if you're burned out, a couple things. 1, it's not your fault. 2, you're not alone. So considering, and I'm going to talk about physicians, but this really applies to all healthcare practitioners. Just curious, how many out there are physicians? Raise your hand. Okay, great. How many nurses, PAs, NPs? Chiropractors, other things. Excellent. So considering, that burnout rates are very high for healthcare practitioners. And for instance, doctors have a 42% higher burnout rate than the general population. So think about that. And think about how resilient a person must be to get through their training, whether it be a physician and all that training, a chiropractor, a nurse. It's a lot of work to get through that training. So if you take all of that together, it means the system must be broken. 2019, this is before the pandemic. Ever felt burned out from medicine? There's physicians, 92%. Burned out currently was 68%. A lot of estimates are about 50% on other sources. So why address your stress? Well, burnout, or the less well you're doing, reduces patient satisfaction, increases medical errors, increases practitioner turnover, increases medical costs, and it's really not fun, right? It's just not very fun at all. How is the healthcare system broken? How does it cause these problems with physician distress? Well, one is high volume expectations and systems inefficiency cause physicians and other healthcare practitioners to be overworked, and that causes practitioner distress. Number 2, if we don't have the resources we need, our patients can't get the medications or the therapies that we think are important, that's hard for us because we know what we want to do, they can't afford it, they can't get it, we don't have it, and then we have that moral injury associated with that. Now, what happened during the pandemic to make all this worse? Well, the high volume expectations for a lot of folks, especially in the ICU and the ER, were increased. Not only were the systems inefficiency, we had to make whole new systems. And then all of a sudden, the lack of resources were worse. Where before were you hearing about lack of PPE, lack of ventilators? This was a whole new thing. We had safety concerns about our own safety. We had financial concerns because some people were too busy and too stressed out, but others were having, if they were doing elective procedures, for instance, were having financial concerns about having enough volume. People didn't want to come to keep their appointments. They were scared of getting sick. And then our own social isolation. I know I used to meet with a variety of physicians every Monday. We'd have lunch together. Doesn't happen anymore. And then the other thing that was hard is patient mistrust. We would say, I really recommend that, for instance, you get the COVID-19 vaccination, and they were listening to some other source of information where people that have trusted me for 30 years on that, all of a sudden weren't trusting me anymore. So I came up with a term in a paper with Cliff Knight, SDRMS. It probably won't catch you on that much because it's a really long term, but I think it's worth saying what that means instead of just talking about burnout. It's system-induced distress. And that makes it clear that it's not our fault. But if we ended it there and we just said system-induced distress, then we would say, oh, well, I'll wait till the system to be fixed to feel any better. And in fact, we want to say it's responsive to multi-level strategies. Okay? System-induced distress, responsive to multi-level strategies. So there are a variety of ways to remedy it on multi-levels. And one of the better models I like seeing is the family physician ecosystem by the AFP. And you see you have different ways. You can have the healthcare system changing, organizational, practice, individual and physician culture, or healthcare practitioner cultural ways of changing it. So at the healthcare system ecosystem, we're talking about ways that we can reduce administrative burden, more universal healthcare, having adequate supplies. And here's the remedy is really political. It's working with your specialty organizations, your senator, your representative, et cetera, to get healthcare system change. This is not something that you can really do on your own. Organization ecosystem. So this is if you work for a big organization. I work for a 200 physician multi-specialty clinic. So that would be an example there. And the thing here is we want to be careful to give specific recommendations with logic instead of just saying vague complaints or insults or things like that. We want to be able to give effective feedback. And we're on the front lines. We want to make those suggestions as someone on the front lines. What also would help is more of the people on the front lines being in leadership, clinicians having a leadership role. Now we go to the practice ecosystem. So although I have a big clinic I work for, I have a little practice with two other doctors in a small kind of family practice in our office. So this is something I can really do on myself. I can learn to effectively delegate and utilize my staff to the top of their skills and license. I can do efficient documentation. For instance, you want to use tons of templates, okay? How many of you use an EMR? Raise your hand. Okay, so if you use an EMR, use tons of templates, and there's some resources there. If you go to my website, stressremedy.com, click on physician resources, then there'll be a whole list of resources. Again, good for any healthcare practitioner, PA, NP, that uses an EMR. And that'll save you time. And here's how you get there. Resources for physicians, and you just click on that free EMR template. You also notice above that, there's several articles, most of which that I wrote, on different ways to reduce physician burnout. And those are some free resources, too, on that site. Secondly, as much as possible, if you're using an EMR, you want to document in the room. So here's how we learned when I was in medical school. This is how I learned to document. And if I were to try to do that for all my patients, I would go crazy. You just don't have time to do that. So what I like to think about and say is when I document, sentences are for novels in prisons. They are not for documentation of a visit, okay? No conjunctions are even needed. You've got that semicolon button. Everybody kind of put up your pinky. Come on. This is how you hit your semicolon button. It's right there under your pinky. And two buttons over is your enter button. So with just using those small hints, I went and I magically transformed this note into that note with a 75% reduction in characters. Now, this is something that I can do as the patient is talking to me and still be present with the patient, still be there, not have my head buried in a computer. And which note would your colleagues rather read? Nobody wants to read a whole big, long paragraph if they're busy. Then we come to the individual ecosystem. Now, the individual ecosystem, a lot of these things I think we know. right? Eat well, and by well, I mean healthy. I'm a proponent of as much as possible, more towards a whole food, plant-based diet. Not absolutely for everybody, but as close as you can get to that, the healthier. And get regular exercise, get adequate sleep. Good social support is really important. And have a balanced schedule, a reasonable work schedule, not seeing 50 people in a day, right? What is reasonable for you, and having some sort of balance in your life. What else can you do right now to reduce your stress? Well, let's look. This is what we're going to talk about today. What is mindfulness? But I know a lot of you have some familiarity of mindfulness. We'll talk about it in a little different way and talk about it. How can you specifically apply it to your lives in healthcare and also at home? Reframing to reduce those frustrations and practice in home, and then a little extra bonus material. I want to be clear that everything you learn here, you're learning for you, your own lives, but also your patients. Right? Because you can teach these skills to your patients. So you don't want to just have a white belt or a yellow belt in learning these skills. You want a black belt. You want to be here, and that's where we're going to work towards getting you, at least introducing you. First of all, what does mindfulness and not mindfulness look like? Well, if we're not mindful, we're feeling annoyed and frustrated. Okay? We want to get the visit or the day just over with. That's what the office is like in there. And we all are like that sometimes. But when we're mindful, and we're all like this sometimes as well, it's when you're really connecting with your patients, where you're enjoying the interactions, where you, even if you have to review work on the computer, you're calmly and efficiently doing so. At home, when we're not mindful, we're obsessing about work when we're home. We're not really communicating with our spouse and children. When we're mindful, we're enjoying our free time. We're fully listening to your friends, your family. You're creating healthy and supportive relationships. So, to get a sense of mindfulness, right now, what I want you to do is pick out a peak experience. Pick out in your mind, was it looking at a beautiful sunset like this? Was it holding a newborn baby for the first time? Was it skiing in fresh powder, surfing, whatever? Just pick out one. And then think of your day-to-day life. Thinking about waking up on an average morning and saying, and it maybe wasn't like that. Maybe it was like, I wish the alarm wasn't going off so early. And then maybe you got an argument with your spouse or kids, and it's like, oh, if only my kids could behave. If only traffic wasn't so busy. Why is work so busy? Why is work not busy enough? There's a stream of judgments about what's going through your mind. Now, let's say we took a sunset like this. Let's say we took that beautiful peak experience and we overlaid those same thought processes. And it'd be like, oh, the sunset's okay, but it's not as nice as the one I saw the other day. The sunset's okay, but it's kind of cold out here. And you think, wouldn't everybody have a peak experience of that sunset? But I guarantee that some people didn't. They were thinking about something going on, or they were comparing it to another time. So this mindfulness, when we talk about mindfulness, simply, it's this moment-to-moment, on purpose, non-judgmental awareness. It also has this quality of being kind, accepting of what's going on right now. There's a curiosity about mindfulness. Again, people sometimes, they talk about mindfulness just the same as meditation, and they think, well, mindfulness just means I have to be meditating an hour, twice a day. No, mindfulness, you can practice mindfulness and meditation, but the meaning of mindfulness is a little bit different there. So let's start to get a hang of this. We're going to start by taking one mindful breath. We'll just feel the breath, as opposed to just thinking about it, judging, we'll just feel it. So as we breathe with our diaphragm, most of you know the abdomen will expand. So right now, everybody, please put a hand on their abdomen, okay? Everybody, and then when I say to go, I want you to feel one breath where the abdomen expands. Just feel the sensation, okay? Ready, and go. Nice, right? One of the parts I like about the talk is I just reset. Feel a little more relaxed when I do that exercise. Just one breath makes a difference. So, in general with mindfulness, how do we increase the amount of mindfulness in our lives? Well, I want you to pay attention to all these complex steps. You ready? Step number 1, patiently refocus your attention to the present moment. So it could be that breath. It could be if you're walking, you might feel your foot on the ground, one foot at a time. It could be feeling the sun or wind on your face. Just fully tuning into your senses, what's happening right now. Okay. Now, the next complicated step with mindfulness, let's see, is patiently refocus your attention on present moment sensation, okay? And the next step and the next step. So actually, maybe it wasn't so complicated, right? But the key I want you to pay attention to there is patiently refocusing. You see, if anybody that here has said, oh, I can't do this mindfulness thing, I just tried it, doesn't work, tried to meditate, doesn't work, whatever, here's the problem. They were using the wrong yardstick. What do I mean by that? When I say be mindful, it's not about being mindful for 20 minutes or 10 minutes or 5 minutes. It's for one breath, one footstep, one bite of food. And how our minds work, your mind is going to wander. And then what you're going to do is gently refocus it and gently refocus it without giving yourself a hard time. We give ourselves a hard time on so many things. On this, you just want to gently refocus it again and again. And here's another reason that's important, because when our stress builds up, with S being each one of these little stressor, the stress builds up, another stressor builds up, and stays up at this really high level now. What happens when we're mindful, even just for a moment? The stress level comes down. So even if we increase the amount of mindfulness in an hour from 1 minute to 2 minutes, might not sound like much, but you're actually doubling the amount of stress reduction, because each little moment has that residual stress reduction. Here's an example. Let's say you're stressed out and you have a physical sensation, a common one. It could be any physical sensation associated with stress, but a common one is your heart's racing. So your heart's racing, boom, 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 boom. What happened if I resist that? Arrow number 1 and say, my heart's racing. I hate this. I wish my heart would slow down. I want you to give a thumbs up. What's going to happen to your heart rate? Thumbs up or thumbs down? What do you think? Let's see. Thumbs up. Correct. It's going to go higher. And what if I say my heart, if you blame it on something else in which the external circumstances were different? My heart's racing really fast because my work is so busy or not busy enough, or my spouse is doing this or whatever. The heart rate's going to go up even higher, right? And the heart rate, and then look at arrow number 5, as you're getting more anxious, then maybe you do a habitual behavior. Does anybody go smoke because they think, oh, smoking's really good for me, I'll do it now? Do they smoke? Do they chew their fingernails down to the cuticles because they think it's a good fashionable look? They really thought that one through? No. They do it because their mind is so busy wishing that things were different, and they're so anxious that they resort to a habitual behavior that they know their body knows gives them temporary relief, even though in the long term it could be a harmful behavior. So what's the other choice? The other choice is, your heart races and you say, for now, I've checked out with my practitioner. It's not a heart issue. I'm going to just let my heart race as fast as it wants to go. And then it slows down because there's not that vicious cycle. And you know what? I know that I'd like some things to be different about my work, but I'm going to make a goal for that in the future. Right now, the present can only be as it is. So I'm going to just be present with what's going on and accept it. And again, no vicious cycle. You have a time to thoughtfully respond. Let's talk about Bob. Bob just got some bad news about one patient, and he needs to be focused on the next patient. Okay, have you ever done that? You have a patient with pancreatic cancer, and the next one comes in a sinus infection. You're so worried about the last one. You got to refocus and be present. Dennis is at work and is distracted about an issue at home. Kathy is about to present grand rounds for the first time, and she's nervous. Okay, so what is a way that we can relax on the run? Okay, relaxation on the run, if we only have seconds. Well, one is we can take one diaphragmatic breath. We did that, right? Another thing we can do is we can say, we have this adrenaline burst as opposed to wishing it away and, getting stressed about being stressed. We say, great, I have a lot of energy. Let's go use the energy. For that person giving the presentation, they'll give them that much more of a dynamic presentation, right? They're going to use that energy. Here's another one. We're going to do a diaphragmatic breath. This is something we're all going to do together. We're going to feel the abdomen expand on the in-breath. On the exhalation, we're going to relax the muscle group. Maybe we'll do shoulders, neck, and jaw. Okay, ready? So breathe in, abdomen goes out. Shoulders relax. In abdomen. Out neck. In abdomen. Out, jaw relaxes. Again, in a few breaths, few seconds, it can make a big difference. If you do it again and again, just, sprinkle that little 5 seconds into your day, particularly if you stress a muscle group. Does anybody know they have one that they stress out? Maybe your neck or your jaw. Then you just say, oh, the one I'm going to do is I'm going to have my jaw relax, and whatever that muscle group is for you. Whatever you're doing, you're going to fully immerse yourself in the activity. You're talking with a patient, you're distracted, you just refocus. You're eating, you smell the fragrance of the food, one taste. You're ironing out one wrinkle at a time. Ballet pose. If I say, well, just relax your body in a relaxed posture, we don't want you going around like this, too. This kind of seems like a relaxed posture. You want me to do the rest of the lecture like this? Probably not. But a way to do it was what I call the valet pose. So right now, imagine your spine is the pole in the middle, okay? Imagine your shoulders are the hanger on the side of the pole. Now let everything else, all your other muscles, just be loose and free. And just tune into your body in that way. You're relaxing in good posture. So I could just say valet pose. You get that image, boom, you do it. Spine, shoulders, everything else relaxed. Takes a few seconds. Okay, let's say if you have a few minutes. Dr. French is worried about a family member and has trouble getting to sleep. We've all had trouble getting to sleep at times. Dr. Evans feels like he needs to relax when he gets home from work, but finds it difficult to do so without taking several drinks, maybe a few too many drinks. So right now, you might be sitting at your looking at your computer now. I want you kind of maybe to get comfortable, and you can put your notepad down and have a seat and sit up straight, legs apart. And we're going to spend maybe 2-3 minutes doing a quick mindfulness exercise, and then we'll talk about it. So everybody now, close your eyes and focus on one breath at a time, just like we did the diaphragmatic breath. Abdomen goes out and back. Just feeling the sensation of one breath at a time. You may hear some noises, and then any sounds you hear can just be a signal to be more relaxed. Any body sensations, when you have those, see if just for now you can allow them to be as they are, not resist them, just for now. And again, focus on enjoying, really tasting the full inhalation and the full exhalation, one at a time. And certainly during this exercise, your mind will drift to one subject or another. And when it does, and you notice that you're not feeling just one breath at a time, that's fine, it's normal, but just gently redirect the focus on feeling just the very next breath. So enjoying the in-breath and the out breath. One breath at a time. Now bring your attention to your feet and allow the muscles in your feet to soften. Allow your lower legs to soften, your thighs. And if you have trouble relaxing a muscle group, just bring your curious attention there. Let your back get heavy, your shoulders, your neck, your arms and hands are heavy, face, jaw, even your little muscles between your eyes. And now get a sense of your whole relaxed body. Taking one inhalation, one exhalation. So feeling your whole body in the process of taking one breath at a time. In a little bit, I'll ask you to open your eyes, and when you do, you will feel more peaceful, you will feel more relaxed. And keep focusing on one breath at a time, and when you're ready, allow your eyes to open. Okay. Hey, everybody. Feeling good? Okay. Why would we meditate? What's the purpose of meditation? Well, one, people can use it if they have trouble sleeping. I usually at night, I meditate and focus on one breath at a time and drift off to sleep because you can help it be more awake in the morning. So maybe in the morning, first thing in the morning, you sit up straight, you don't lie down. You sit up straight so you don't fall back asleep, and maybe you'll be more present, more awake. Maybe have be able to relax more deeply, like that person that was having too many drinks, and that's the only way he or she knew how to relax. But you don't try to relax, you just meditate. And if you follow what we talk about, you're more likely to be more deeply relaxed. The most important part when I talk about meditation, I think, is to practice mindfully refocusing so we can have that skill during the day. So when you're in the midst of the day and you're thinking, oh, why can't this or that be different? You can just take a breath. Just notice your thoughts as thoughts and not necessarily reality. Take a breath and be more fully present when you're in the midst of the day. And you practice that when you meditate. So what we did today is we did some mindful diaphragmatic breathing, one breath at a time. I did a body scan, just feel and relax one muscle group at a time. And the key again, when your mind drifts, you focus back on whatever your type of meditation you're doing. We did breath meditation, could be body sensation, sound, could be music, could be a repetitive phrase. When I'm having trouble sleeping, sometimes I like the word one because it reminds me it's as easy as focusing on one breath, just focus on this one single breath at a time. But if you have a short prayer, whatever, you can use anything to do with meditation. And again, there's movement meditations like yoga, or we had another session before where somebody did a dancing meditation. All of those is you just keep returning yourself to what's happening right now with a curiosity and non-judgmentally and without resistance. Now, there's what's also called mindfulness meditation. That's when you go, maybe you start with breath and then body, and then you're just sitting open, aware of whatever comes up into your awareness and just noticing it without any judgment, just with curiosity. If you do have insomnia, a couple hints. One is sleep hygiene. We'll give you a slide on that. But two is if you try hard to get to sleep, oh no, I'm going to feel awful in the morning if I don't get to sleep. This is going to be terrible. How many raise your hand if you think that's going to help you with your sleep? No, it's not, right? So instead you think, oh, I'm having trouble sleeping. I'm up late at night. It's dark. It's quiet. What a perfect time to meditate. I really didn't get enough meditation today. It's a perfect time. Then you're more likely to drift off to sleep. Here's the sleep hygiene hints. I think a lot of you know these. Obviously, you don't want a double espresso right before bedtime. You don't want to try hard to get asleep. If you have a ton of concerns on your mind, sometimes writing them on paper is a good way to get them off your mind. You don't have to keep practicing the scenarios in your mind, and you're more likely to get back to sleep. Having a regular routine, etc. Not having a lot of bright lights at night, etc. Here's on my website, stressremedy.com, on the audio section. And here you'll see a list of meditations. The first one is a little 3-minute one, similar to what we did here. Then there's a variety of other ones, a longer meditation, a letting go meditation, loving kindness, a reframing one. And at the very end is a one for people having insomnia. So what I'll recommend people doing is they click on that, they make sure you hit listen in browser, not listen in SoundCloud, because then it'll go to another movement. But if you hit listen in browser, then it's just going to play that meditation and turn off. And more likely than not, most people will be asleep either by the end of the meditation or within a few minutes afterwards. Also on the website, there's a link section. And the link section has a variety of other meditation resources. So you can see another meditation website. You can see different mobile apps, one of which is in Spanish from UCLA. So look over the link section there too. I will say, if you have a favorite website you like, how many of you know how to take a website on your phone and add it to your home screen? Who knows how to do that? Great idea to Google how to do that. I had a slide how to do that, and we took it out, but learn how to add it's really easy to do. And then it's right there on your phone. You don't have to look up the whole web page again. You just click on the home screen and get straight to that whatever meditation site you like or other site you like. What are some barriers to mindfulness? I don't want to. I don't want to do my EMR records. Okay, don't. Or I don't want to do my refills. Okay, well then don't refill the medications. Well then my patient might die of a stroke because they don't have their blood pressure medicine. Okay, then you actually do want to do it. Quit deceiving yourself, right? So we keep saying, I don't want to do my homework, my kids might say. Okay, then don't do it. But I don't want to fail. Well, then you do want to do it. So let go of the thought, I don't want to do it. I'm overwhelmed. We've all been overwhelmed. Have the thought, I'm overwhelmed. The first thing you do is notice it as a thought. Do what's next on your list. It might be taking a breath. It might be making a plan of how to do what the next things are. Do what's next on your list with your full attention. It might be getting help, to somebody help you to do the work. And people have thought mindfulness is too hard. Again, we can disprove that in 10 seconds. Okay, everybody now focus on one breath. Enjoy one diaphragmatic breath on the count of 3. 1, 2, 3. We could do it, right? It's not too hard. If you think it's too hard, it means you're using the wrong yardstick. It's just one breath. It's about patiently refocusing. So when people get a taste of mindfulness, the one thought, it's a relaxing break from your busy day. But a little more in-depth look at it would be it's noticing thoughts without always believing all your thoughts, but also without resisting your thoughts, not without going, if only I had a clear mind and be okay, just noticing them as thoughts. And patiently, without giving yourself a hard time, focusing back on the present. It's also even noticing the beginnings of this desire. You feel like eating some food that is not on your, what you want to eat, or you're smoking, whatever, and you notice what does that desire feel like? What are thoughts associated with it? And when you start slowing it that way, without trying to push anything away, the thoughts can just come and go without believing them, and the sensations, probably you just kind of notice it without resisting it, and it also just kind of comes and goes. So let's talk about our office. Some of you may be in a circumstance like I am. And I might be here, right here in my office, but I'm going to see a patient over here in my exam room, okay? How many of you have a situation like that? Okay. How many of you have a situation not like that? Okay. So some yes, some no. But we'll apply this anyhow. So we go and we're about to see the next patient, and maybe we're distracted about something at home or whatever's going on. We're going to go ahead, and the first thing we're going to do is we're going to feel the footsteps on the ground. So everybody now stand up, please. Stand up. And I want you to roll your right foot from heel to toe, back and forth, heel to the ball of the foot, and feel if you can massage your foot on the ground. Just tune into that sensation. Do the same thing with the left foot. Just tune into the bottom of your foot and enjoy kind of a little massage on the ground. So imagine now you're going to walk and you're going to tune in to the sensation of your feet on the ground. You're just going to feel that. And then you're going to go and you're going to know you're going to about to see the next patient. So I'm going to set my intention to be with that next patient, to learn about that next patient, to be curious. And you might just take a mindful breath, or you may take a mindful breath and say some little mantra in your mind, like take a breath in, think curious, and breath out, kind. Or just feel one breath at a time, either way. Now imagine yourself gripping. You might take a little knock on the door and feel the cool handle. You're going to feel the cool handle, open it up. And then you're going to come in, and you're going to say, "Hi, Mrs. Jones." And you're going to kind of really mean it. You're going to really be present. So go ahead and sit down, because now you're talking with Mrs. Jones, seated. And maybe there's some part of your exam, if you're a physician, maybe you're listening to the heart, and you're just going to fully bring your attention to sound and listening. If you're a chiropractor and you're doing some manipulation, maybe you're going to feel your hands and feel the energy and feel your hands. And then maybe you leave the room and you have a chance to take some lunch or just a nice cup of tea. Imagine right now you're taking this cup of tea or coffee and you're feeling the warmth on your face and then taking one taste and feeling it go through your tongue. So that's how you be more mindful. You have these little situations. Now, it might not be all of them, but could you just think about picking a couple of these in your day, in your routine? You imagine it'll refocus you, being ready for that next patient. This was what I'd see on the door, and as you could see as I walked to the exam room, I would see this view, and you could see it would bring peace and relaxation to my mind, right? Maybe not so much. So I did something, so I got a $5 poster, just so it would remind me to be present, to feel my feet, to feel the trail before I went in there. Well, we all got used to these, right? So you know why obviously I'm wearing this is because I was really trying to look like this guy, right? Or maybe this guy. And I need to reframe it because sometimes I get frustrated with the mask, and I had to remember, oh my gosh, I'm so thankful for this mask and this equipment to protect my health. So to be able to reframe that, but also to take it off between patients and grab a drink of water, because for not this last birthday, a couple birthdays ago, right towards the beginning of the pandemic, for my birthday, I got a stone as a present, and some people might like rubies. Some people might like diamonds, but unfortunately the stone I got was this one. It was calcium oxalate in my left ureteropelvic junction. Wasn't so fun. And I think one of the reasons is I wasn't taking the time off to take some water between leaving my mask on all day. So if you don't like this present, then remember to take your mask off between patients once in a while and drink some water and stay hydrated. What are things that you find frustrating, okay? Do you find rude patients frustrating? I'm going to have you pick which ones you're most frustrated with. Non-compliant patients, patients inappropriately requesting narcotics, computer work, you like seeing patients, but you hate the computer work, or all of the above. What do you guys like the most? All of the above is winning. Okay, so we'll talk about all these things. We'll talk about Dr. Winston. He's stressed out about a patient being rude to them. Why are you so late? I can't believe you're late. I'm a busy guy. Well, how can we reframe that? Well, number one, how many of you, raise your hand, if ever in your entire life you've ever been rude, raise your hand. Okay, raise it high, if ever in your entire life you've been rude. Okay, now let's put it down. Raise your hand if usually, when you think back when you're rude, it was when you're happiest and feeling your best. Not so many hands now, right? So when we're rude, it's almost always when we're suffering. So if you want to find suffering people, where would you look to find them? Maybe in a healthcare practitioner's office, where you might happen to be, right? So if you keep in mind that patient's probably suffering, you're less likely to be insulted and take it personally when they're rude. David is annoyed with a patient. Now he ran 20 minutes late to spend extra time with his patient. Lots of time recommending the perfect medications he thought, a great diet, quitting smoking, laid it all out, discussed it, comes back the next day, nothing happened. So the idea of compliance. I don't even like the word compliance. When I think about compliance, I think that there's a boss paying an employee to do a job. So how many of you pay your patients to come see you? Raise your hand. No, right? They're paying us. So they're paying us to be caring consultants. Our job is to both connect with the patient, coach them, and offer expert counsel. When we do that, then we can listen, and you can say, "Oh, well, why didn't you take the medication or quit smoking or the things that I recommended?" And maybe they couldn't afford the medication. Maybe something happened in their lives. It was just too stressful. We hear, we're with them, we connect, and eventually they're more likely down the line to have the healthier choice. I've recommended a lot of patients quit smoking. I've had a lot of my patients quit smoking. It's uncommon that they quit the first time I advise them to do that. It's often over the course of our relationship. And we do have to listen when we do that. One of the frustrations to a lot of people, for instance, is with COVID-19, we talked about that mistrust. So we really need to listen. I came up with a mnemonic to help with that, with getting permission to talk about it, being empathetic. I think it's P. Slow I came up with. Talking to the patients about why I have my expertise, to go through all of this difficult, information and, all the years in medical school and residency and my 30 years of experience. And also talk about my non-expertise and tell my patient, please don't ask me how to drywall something or do electrical work. I don't know anything about that. But I do have expertise about that. And I have to set an agenda ahead of time because otherwise I run out of time as far as how much to spend on each thing. So set an agenda about how much we spend on this issue ahead of time so I'm not surprised about by the way. Reframing. Ellen is anxious about seeing his next patient who wants narcotic medication, but he suspects the patient is abusing drugs. So she suspects, I'm sorry. Got my pronouns maybe messed up here. So the one thing that I want to talk to you about is a lot of us don't like conflict, right? So how do we make this to eliminate the conflict as we emphasize what we have in common with our patient? Realize that we have the same goal. I want them to be well physically, emotionally, psychologically. They want the same. We just have different strategies. And I can tell them that my goal is to first do no harm. And that if I prescribe too much narcotics to you, these are the particular harms they may have. What are the alternatives that we could do? Sometimes narcotics are appropriate, but sometimes not, and sometimes we need other referrals and other ways of dealing with it. Computer work. A lot of people help this, or paperwork, the same thing. So some people, this is the big frustration they have. Dr. Nelson enjoys seeing patients, but hates the paperwork and computer work. So have your team, if you have a team of people that work with you, work to the top of their license and ability. But we know that obsessing about trying to make something go faster or go away doesn't make it any more pleasant. So how can we reframe this? Well, number one, I don't call it computer work. because for me, it's important patient care, and I use the computer for it. So the computer's a tool, but those refills are important, those messages are important. I remember once I came back from a long conference, a week-long conference, and I usually like to come back on a Saturday, so Sunday to catch up on this type of work. I started getting a knot in my stomach because I knew I had 4 hours of work to do. And I said, I don't want to do this computer work. And then I reframed it another way. Because I thought, what are the advantages of this type of work? Well, I can do it at my own pace. I can do it listening to some relaxing music. I can do it with a cup of tea or coffee, okay? Things that, when I see patients face-to-face, this is not how I operate. So there's advantages. So I renamed it my relax and review time. Might sound silly, but that little reframing just had me do it one step at a time, and I was less stressed with it. There's a speaker and a cup and mug in my office. Dr. Harris's patient had a poor outcome. He's beating himself up, wondering if he would have done anything differently. And sometimes things go poorly. And I know even if I did nothing at all wrong, which is usually the case, I still look back and think, is there anything I could have done better? But you want to do this not beating yourself up. Thomas Edison said, I'm not discouraged because every wrong attempt discarded is another step forward. So you go with it, what can I learn from this? Not what an idiot I am. Treat yourself like you treat a colleague or a friend, with compassion. Maybe there's something that even if I didn't do anything wrong, what could I maybe do something a little better? It's a learning opportunity, but remember that we're all human and we're not all perfect. None of us are. Also, an important thing in reducing our stress and having a sense of purpose is acknowledging when what you do makes a difference. How many here, for instance, are in primary care? Anybody here? Not many. There you go. I know in primary care, we do things that we do preventive health a lot. How many here do any sort of preventive health? Anything that you'd consider preventive health, okay? So you go and say they do something, say great teamwork. We got that blood pressure down and your cholesterol's improved. We may have just prevented another stroke. Neither of you probably really think about that, but take that time to acknowledge what you're doing. Or they found you helped stop smoking, you help with their diet. They got that colonoscopy, they saw a small polyp, and now they won't get colon cancer. So remind yourself and the patients of the difference you're making. So you remember that sense of purpose. Sometimes there's little stresses in the day, sometimes there's big things. Sometimes there's things like divorce and death in the family. How do we use mindfulness to help with the really difficult times? Well, what increases our suffering with difficult emotions? Resisting them. Then we get anxious about being anxious. We get sad about being sad, depressed about being depressed when we resist them. The other thing we do is we justify our emotions. We say, well, sadness or anxiety is not okay. Let me list the 10 reasons to justify me feeling the way I feel. So how many think if you list 10 reasons that justify you being sad, you're going to be happier? Right? No. So we want to resist that urge of trying to, and sometimes of trying to justify all our emotions. So what would happen if we would just accept our emotion for now? Just accept it with that curiosity, with that interest. What would happen? And also simplified it. A lot of times we tell ourselves complex stories about our emotions. Bruce Springsteen sings, it's like someone took a knife, baby, edgy and dull, and cut a 6-inch valley through the middle of my soul. And you feel that, right? You get that right in your chest. If he just just sang, I feel kind of down, it wouldn't have sold many CDs at the time, right? So it's useful for literature, for songs, for theater, but for ourselves, we want to be simple. We want to simplify it. We don't want to use those complex metaphors. So when you're going through a divorce, what's the physical sensation? Tightness in the neck. What's the emotion? Sadness. What are the thoughts? I feel incredibly lonely, etc. I feel like I'm at the bottom of the deepest pit and there's no way out. Well, you're not really at the bottom of the deepest pit in the world. Notice that as a thought. One thing that's helpful for that is a little meditation in cognitive behavioral therapy that's called the 3-minute breathing space. The way I like to do it is you spend the first minute just noting your emotion with acceptance, just allowing yourself to feel the way you feel. And you break it down. What's the physical sensation like we did? What is the emotion? Maybe just in simple terms, happy, sad, angry, relaxed, high energy. And that encompasses both anxiety and excitement. And then what are the thoughts? Noticing them as thoughts, not having to believe all of them. Next minute, spend on mindful breathing. Next minute, expand your sensation on the sense of the whole body breathing. That's the 11th exercise at stressremedy.com audio. Again, all these resources are free for you. Remember, when it comes to our lives, this might be your financial portfolio. I know the stock market's down a bit now. It's not your life portfolio, which looks a little bit more like this, with the stocks, bonds, and cash being those little parts. But taking time, whether it being a gratitude journal or in general, just taking time to talk about times when we're enjoying our health. I'm grateful for my health, my vision, my family, my friends, food, shelter, etc. And we do that as a regular part of our day once a week, listing off three things, a couple weeks, put a reminder in our phone. What we're trying to do is not just get that one list of a gratitude journal, but make that a habit that we're looking out for the things in our life to be grateful for. So that's the usefulness of the gratitude journal or making lists of things to be grateful for, is that it hopefully makes it as a reflexive part of your day. I'll tell you one really interesting thing is that I can't believe this. I was in a race, swimming race with 50 million others, and I'm not that good a swimmer, but I won, so it's just crazy. Here's my winning picture. But it reminds us that it's a miracle that we're even here, right? How did we, the sperm that was us, win that race? From 50 million others. And how did our parents even meet? And how did their parents even meet? And that one sperm win that race? And you just got to reflect sometimes on what it's a miracle is that we even have this brief glimpse of life that we have. So that's another thing sometimes to be grateful for. Just remember this guy right here. You are the winning sperm. So fit gratitude into your day. A gratitude journal after meditation. Maybe a reminder on your phone to set an alert. I also want to really talk to you about asking for help. This is so important. This might be the most important part of the talk. Please pay attention to this. Well, first of all, let me just ask you, who do you connect with the most? Somebody who seems to be perfect, shows off that they're perfect and shows off all their gold and doesn't admit to any flaws? Or somebody that's a real person that admits to flaws, that admits to some problems? Who do you connect with? For most of us, it's the latter. We connect with a real person that admits to flaws, yet somehow we want to try to pretend that we're perfect. So when you need help, ask for help. And getting that help should be a sign, or is a sign, of strength, wisdom, and professional maturity. You might get help from your primary care provider, a counselor, employee assistance program. Remember, any counselors now are probably doing televisits. Almost all of them do. So it's easier than ever. Don't wait till you're at wit's end. Get assistance early and often. So this kind of slide sums it up. Practitioner well-being. Practice efficiency. We get more time with patients and time at home. Reframing. reduces our frustration, and reduces our feelings of otherness and objectification. What do I mean by that? The otherness is that people are separate. They're different than you. That'd be otherness. Objectifications, we treat people like things. So the non-compliant patient, that wastes your time. The rude, entitled patient, that makes you angry. The drug abuser, that makes you uncomfortable. And you might think I should use the word who instead of that. But that's the point. We treat people as things. So it reduces the otherness, objectification. The mindfulness lets us be more present. And all of that increases our fulfilling human connection. This is a poem, and maybe I'll quickly read this. This will be my end. It was a difficult day. I was up all night, and this is where a reframe hit in for me. Early this morning, this is a poem, Our Ship, from my book, Relaxation on the Run. Early this morning, I cared for a patient with severe dementia, he not able to talk or get up out of bed, and I not able to ignore or deny someday I may be like him. His hair sought, mine with some pepper left, his skin with furrows, mine with lines. Physical and mental health are treated like a given, but the only real given is that they do not last. In the past, I have actively ignored this, so not to be depressed by this, but now it is my connection to this person. So here's the change. And to all people, we are all on the same ship, crewmates on this voyage, through calm seas and rough waters. The only way the trip makes sense is to take it together, kindly connected with heart, courage, empathy, and love. So here's my information to connect with me. My resources are at stressremedy.com. We mentioned that. And with that, I'll take some questions. If anybody has some. Thank you very much. Thank you so much. Yes, I'm not a faculty. Well, actually, I am a faculty at USC medical students, but it's only clinical, so I'm not part of the first and second year medical school education, but I commonly do speak to different medical groups. I have a talk with residents that's coming up relatively soon after I leave. So I have talked with medical students and residents and various physician groups and healthcare practitioners. Thank you. Be good to get the curriculum out to even more than them. Thank you. Any other questions? I think we have and the question was, do I teach this to medical students? I think we have some mics up too. Anybody has any other questions? Anything else? Okay. Well, I will stay for a few minutes here and I'll throw my mask, and we can all kind of, if you have any personal questions, feel free to ask me about that. We have another couple seconds. Anything else? Again, I want to reiterate, it's been a pleasure to be able to see real faces out there. This is the first time in a while that I've been able to do that. I don't know if it's been a year and a half, 2 years, whenever the beginning of the pandemic was. I think closer to 2. So my applause to you guys. Thank you so much.